Okay, I believe the glitch is fixed. We're gonna start from the beginning. Namaste, everyone. A very warm welcome to our webinar, Pandemic, Punekars, and Policy. This webinar is hosted by the Nyan Prabodhini Foundation's Analytics team. I am Arya, joining live from Seattle, Washington.
And I'm Pranav, joining live from New York, New York. As our chief guest today, joining us from Pune, we have India's most influential thought leaders and renowned scientist, Dr. Raghunath Mashelkar. Also joining us from Pune, we have the Chief Operating Officer of Pune Knowledge Cluster and a researcher herself, Dr. Priya Nagaraj. A very warm welcome to Dr. Mashelkar and Dr. Nagaraj. I sincerely thank each one of you for taking the time to be here today. Let me now invite Dr. Mashelkar and Dr. Nagaraj on screen.
We are fortunate to have such illustrious guests with us today to celebrate the 1-year anniversary of Nyan Prabodhini Foundation's analytics team. Nyan Prabodhini Foundation, or JPF, is a non-political, non-profit organization committed to the cause of social welfare. Established in 2019, this very young organization now has over 200 volunteers worldwide, working on several different virtual projects. These efforts impact the lives of underserved communities and deserving students in India. JPF Analytics is one such project. JPF has also dispersed over $385,000, that is over 3 crore rupees, to support the causes of education, women empowerment, and rural development in India. And all of this in under 3 years. With the motivation we draw from Nyan Prabodhini's grassroots work in India, we have set out on this honest mission of contributing to society and building bridges across communities.
The 21st century will be dominated by a host of global and local challenges. Evolving geopolitical equations, a worsening climate crisis, increasing socio-economic disparities, and technological upheaval are set to shape and transform our societies. Solutions for these issues cannot be formulated in the absence of rigorous research and analysis. Analytics, with a team of almost 50 volunteers, is one of JPF's major projects. We are a computational social science platform engaged in evidence-based policymaking, aiming to build a resilient future. We aspire to become not only a think tank, but also a fact tank. A fact tank that provides policy recommendations based on statistical insights from real-world data. This team was established 1 year ago. That's right, we are celebrating JPF Analytics 1-year anniversary. And on this joyous occasion, Abhishek Dede, the co-founder and program director of our team, will tell us about the team's vision and unveil a brand new logo.
Thank you, Arya and Pranav, for telling us all about the exciting stuff our analytics team is up to. We truly have big dreams, and it is unbelievable how quickly the past year flew by. Analytics is now 1 year old, and it is my pleasure to unveil our team's new logo, designed in-house by our very own volunteer, Unmesh. This logo not only celebrates our past by commemorating our 1-year anniversary, but it also looks forward to the future. Without further ado, let me share JPF Analytics' new logo with everyone. Our logo is meant to represent our identity and values. The interconnected dots have many interpretations. First, they can be interpreted as nodes of a graph or a circuit, and thus represent the computational nature of our identity. Pretty natural for an analytics team. They represent our commitment to promoting a data culture in India. The logo can also be represented as a brain and thus stands for the scientific nature of our think tank come fact tank. They also stand for our endeavor to strengthen the research infrastructure of India by engaging in original research and analysis. Finally, the interconnected dots in this logo represent people-to-people connections, echoing Jnanaprabodhini Foundation's mission of building bridges between communities. This aspect of the logo stands for our commitment to deepening the democratic values of India. Altogether, this logo represents our determination to grow into a computational social science think tank to ensure a resilient future.
Thank you, Abhishek, for enlightening us about the meaning behind the new JPF Analytics logo. It is heartening to see how much thought the analytics team has put into this. It is evident from this that we stay true to our philosophy of deliberating and weighing all factors in every aspect of our work before we finalize it. Since its inception last year, the analytics team has deep dived into several diverse data sets to support our research in understanding the effects of the pandemic. We have also conducted multiple surveys of our own, ensuring we hear the voices of underrepresented communities in and around Pune. The outcome of one such initiative is the Pandemic, Punekars, and Perceptions Project. Sound familiar? Indeed, this study from last year is the foundation for our current research. One of the topics we focused on is the excess deaths that occurred during the COVID-19 pandemic. Many previous studies have suggested that officially reported COVID-19 mortality data may be underreported. No such study has ever been conducted for Pune until now. We have now investigated available public data to determine the true impact of the COVID-19 pandemic. Transparent and accurate data documentation is essential for strengthening public health systems to effectively tackle future epidemics. Let's find out the results of this study and its possible implications from one of our researchers, Niraman.
Thank you, Arya and Pranav, for the introduction. Hello, everyone. I am Niramay Gogte. I am going to present results from our project focusing on the excess deaths that occurred in Pune during the COVID-19 pandemic. Let's begin with a motivational example. So, we all know how tree rings can tell us about what tree has been through during the lifetime. For example, the number of rings can tell us how old the tree was, and the distance between the rings can tell us about how many droughts the tree had seen, and things like that. So just like we can draw inferences about the tree's past from the tree's rings, we can similarly gain insights about the true impacts of COVID-19 pandemic on Pune by studying the excess mortality. Our team did just this using mathematical modeling, public surveying, and analyzing media's reports. Let's dive into the problem at hand. So here is a graph of monthly deaths recorded in Pune over a few years. And simple visual inspection can suggest that there is some overall increase in deaths during the COVID-19 pandemic. This makes us wonder whether this increase is legitimate and how does that relate to the actual pandemic. And this problem sets up the stage for our analysis. So before we go any further, let's start by defining what we mean by excess deaths. In our analysis, we refer to excess deaths as the difference between the reported number of deaths and the expected number of deaths. So in this picture, you can imagine excess deaths to be the overflowing coffee, and the coffee cup representing the reported deaths. So with the help of our team members with various different backgrounds and fields, we estimated excess deaths using 3 methods: using mathematical modeling, public surveying, and analyzing media reports. So let's look at the first method. We used 2 mathematical models to estimate the expected deaths during the pandemic. The first model relies on the average of previous years, while the second model uses a little complex model of over-dispersed person approach. For more details about these models, just refer to our report. So to see whether there were excess deaths or not, here is a graph of total reported deaths along with the projection from our model. So the blue line corresponds to our expectation without the COVID-19 pandemic. And we can clearly see a difference between our projection and the reported deaths. So this difference allows us to compute the excess deaths during the COVID-19 pandemic. So from the graph, we got some idea. So now we can talk about numbers. So the 2 mathematical models that we considered, those predicted about 20,000 and 14,000 deaths during the pandemic, while the official deaths due to COVID-19 pandemic as reported by the government were about 9,000 deaths. So the significant discrepancy between estimated excess deaths and the COVID-19 deaths makes us wonder what could be the cause of these additional deaths. So there are many reasons for this discrepancy. For a few examples are lack of testing, availability of hospitals, and long-term weakening of immune system because of COVID-19 infection. So now that we know there is some discrepancy and we have numbers with us, we can talk about how to quantify this discrepancy. One way to do so is using the undercount factor. An undercount factor close to 1 suggests that all the reported COVID-19 deaths were accounted for. This is a marker for a successful official recording of COVID-19 deaths. And the governments and all the infrastructures can have a goal to reach the undercount of 1. Okay, so now those were the results from the statistical and epidemiological modeling. They provided important insights about the true impact of COVID-19 pandemic in Pune. But statistical models make a lot of assumptions and may not capture all the features of the dataset. Therefore, we also looked into opinions of Punekars about this excess mortality. We did this by conducting a wisdom of crowd survey. You can read more about it in our previous report that we published last year. That was about pandemic, Punekars, and perceptions. The wisdom of crowds approach relies on the fact that public estimates about unknown quantities can be surprisingly accurate. So in this survey, we asked 280 adult Punekars about their opinions regarding COVID-19 deaths. And they estimated about 18,000 COVID-19 deaths during this pandemic. Which translated to about undercount of 2.2. And this result is kind of comparable to what we got from the statistical modeling. So with these 2 methods, we also looked at media reports to estimate excess mortality. So we compiled the findings from 2 reports. First, from Hindustan Times about the mismatch between official reported deaths and number of COVID-19 cremations observed during the pandemic. And the second report was from Indian Express, describing the mismatch between reported COVID-19 deaths and the COVID-19 death compensation claims filed to the PMC. So these media reports suggest the undercount factor of about 1.7 and 1.9 respectively. So up till now, we used multiple approaches to estimate excess deaths during COVID-19 pandemic. We used statistical modeling, then public survey, and then media reports. So how can these diverse approaches be combined together? And what is the big picture takeaway from all of these methods? Well, we used a simple model averaging technique called bootstrapping to compute the aggregate undercount factor. This technique used random sampling with replacement. The consensus undercount factor is about 1.9, with a 95% confidence interval ranging from 1.7 to 2.1. We computed the first ever excess mortality estimate for Pune. This now allows us to compare our undercount factor with other cities in India. These estimates were computed by other researchers who have no connection to our team, so they are not biased with our calculations. In summary, we see that aggregate undercount factor for Pune is comparable to other cities like Mumbai, Bangalore, and Chennai. So this also provides a loose sanity check for our analysis. All right, so that was a lot of data, a lot of numbers, statistics. I hope that wasn't an overload of information for most of you. But don't worry, if there is any takeaway message from our analysis, it's that first, we estimated about 17,000 excess deaths during the COVID-19 pandemic, that is from March 2020 to December 2021. And furthermore, we estimate about 1.9 times undercount by the reported deaths. But these are just numbers. Why should we care? The COVID-19 pandemic has had severe impact on all of our lives, and the true extent of its impact is only now being described using data-driven methods. Such methods allow us to expand our knowledge and understanding of the pandemic, and in turn making us more resilient and better prepared to face any future pandemics. So, thank you.
What an insightful presentation. As Niramay suggested, transparent and accurate data is the foundation for all public health policies and community guidelines. Having precise data also benefits future statistical models. Of course, our own statistical modeling would not have been possible without the data provided by Pune Knowledge Cluster, or the PKC. PKC is a science and innovation cluster set up by the Office of the Principal Scientific Advisor, Government of India. The Government of India's Science and Innovation Clusters were set up in 2020 with the aim of bringing together academia, research and development institutes, the industry of urban centers, and their surrounding areas. Their main focus was to address challenging problems of the region through innovative means, using scientific knowledge and engaging highly skilled human resources. We sincerely thank the Pune Knowledge Cluster for collaborating with us on this project.
Next, we will hear from our fellow researcher, Soham, about our team's Geospatial Portal project. For this project, the Pune Knowledge Cluster graciously allowed us access to their data, ultimately provided by the Pune Municipal Corporation, or PMC. With this data, we were able to create a time-lapse slider on our website that shows the number of new cases in each region of Pune over the course of the pandemic. Additionally, we also made use of another excellent resource of the PMC, the Pune Data Store. The city government has made many open source datasets available on this platform. We visualized some of these datasets in our digital outlets. Let's see a demo of this insightful tool by Soham.
Hello everyone, I am Soham. Thank you Arya and Pranav for the introduction. And thank you Atharva and Rohan for telling us all about the Excess Deaths project. It was very insightful in describing the true impact of the COVID-19 pandemic in Pune. However, it also left many questions unanswered. How did COVID-19 spread across different geographical regions of Pune? Were different regions of Pune equally affected across different waves of the pandemic? What underlying demographic and socio-economic factors may explain the varied geographical impact? The answers to these questions can give us insights of how infectious diseases spread in urban settings. These insights can eventually help with future pandemic management. Accurate and transparent data is critical towards answering open questions about the pandemic. We are extremely grateful to the Pune Knowledge Cluster for sharing an enormous dataset about COVID-19 with us. Our team at JPF Analytics visualized this dataset in our Geospatial portal. We created a time-lapse slider that shows how COVID-19 spread through different regions of Pune over time. I am pleased to now show you a demo of this time-lapse slider. What you just saw was a visualization of how the pandemic spread across different wards of Pune during the third wave of the pandemic. Using this slider, you can explore the dynamics of the pandemic across any time frame to see how it unfolds. The dataset visualized in our time-lapse slider was curated by the Pune Knowledge Cluster from primary data provided by the Pune Municipal Corporation, the PMC. We thank the PMC for making this data available. It is worth noting that the PMC has a range of open data initiatives. Pune was the first city in India with a dedicated data officer. PMC has an open data policy where they are committed to sharing public data with the citizens of Pune. This data is hosted on PMC's open data store where anyone can go and download vital data sets about various topics related to urban life ranging from education and the environment to healthcare and economics. Our team at JPF Analytics visualized various datasets now hosted on our Geospatial portal. We invite you to visit our Geospatial portal and explore these yourself. Let us show you an example map. This map shows the slum population in different wards of Pune. We currently have interactive maps about the demographics of Pune, slums of Pune, and employment in Pune on our digital atlas. However, this is just the beginning. We plan to keep adding maps to our digital atlas. There are many more datasets on PMC's open data store as well as our own that we will soon update. In the future, we envision this being the go-to hub for curated geospatial information about Pune. What kind of maps would you like to see on our geospatial portal? Write to us at survey@jnanprabodhinifoundation.org and let us know. We would love your feedback. Thank you.
Wow, that was a very interesting presentation. They say a picture speaks 1,000 words. We plan to keep expanding our geospatial portal or the digital atlas with more interactive and detailed maps, and hope this platform can help local decision-making bodies and the general citizen to understand and get to know their own city more closely. And now, for the moment we all have been waiting for. Let us turn to our next guest who needs no introduction. Padma Vibhushan and member of Royal Society, Dr. Raghunath Mashelkar. Without further ado, it is my absolute honor to hand over this virtual mic to Dr. Raghunath Mashelkar.
Thank you very much. Let me share the screen first. Are you able to see it? Hello, are you able to see it?
No.
Not yet.
Not yet?
We can see the screen now.
You can see the screen? You can see
Yes.
my slides first slide?
No, we can see your desktop right now.
Oh, just 1 second. Can you see it now?
Yes, it was briefly visible right now.
Now you can see that?
Yes, perfect.
Okay, thank you. Thank you very much. First of all, congratulations to JPF Analytics. Happy birthday. We just heard about the fantastic work that you're doing. Very, very proud to hear that. And equally importantly, your future plans. I think they sound fantastic. As they say, data is new oil, and one talks about the importance of big data analytics in our future. And I really love the great initiative that you're taken. I must make an admission. This topic, pandemic, Punekars and policy. Normally, when I give a talk, I own everything in the talk. But in this particular case, I don't own the title. The title was just given to me, Pandemic, Punekars and Policy. And I loved it so much that I said, let me continue with that title. The other admission is that I'm not an expert in the subject at all. It is I've been an observer and watcher of what's happening and participants in some ways. So my knowledge on the subject is limited, but I'll tell you what I have seen and what I observed. You know, when the pandemic hit us, these were the kind of headlines. India finds itself at the back of the line for virus test kits because state-run labs were operating at only 36% capacity. Private lab managed just an average of 8 tests a day. And in fact, this is somewhat disconcerting. The headline was the priorities are going to countries where there's a major outbreak like Italy and Spain, and the US and the UK. So all major international vendors are saying, I'm not sure how much I can allot for India. So we were really at the back of the line. And then India ran out of time and ran out of test kits. States were advised not to use rapid testing kits for 2 days, need to be validated because the Chinese suppliers, what they gave was not of the quality that we actually required. So we're in a crisis. And as Punekar, one should feel proud that this lady, Minal Bhosle, who was my lab's R&D chief, submitted the kit for evaluation. In fact, she was the first developer of the first COVID-19 testing kit hours before delivering her baby. I think our hats off to her, the real spirit of a Punekar. And she developed this particular kit in just 6 weeks. And see where she started. Started work in January 2020, as soon as WHO released the genome sequence. On 28 March 2020, launched first Made in India kit, tested 1.2 million people in 3 months. There was a 3x reduction in price and 95% of the components sourced locally. When we talk about Atmanirbhar Bharat, this is something very, very critical. And on 25 July 2020, launched the first Made in India antigen testing kit. And the cost was, of course, low. From 450, it went down to 250. Now it is even less. So I very proudly mentioned about what Pune did and what this CTO of my lab was able to do. Wonderful lady. The other set of headlines were on collapse of healthcare infrastructure, distressing news on 15 January 2021. It said, the situation here is dire. Every minute, 10 people test positive for COVID-19. Every 8 minutes, someone dies. Ambulances circle for hours, unable to find ERs that can accept patients. Hospitals are running out of oxygen. ICU capacity is zero. Patients lie in hallways and tents. Where do you think this was happening? You would say, oh, it looks like some developing country, India, Africa, or whatever. No. Can you believe it was Los Angeles? And this is a headline from Los Angeles Times. And it was not only there, but it happened in several Indian cities. Patients lying in hallways and tents. And then I'm very proud to say there is this young man, Mudit Dandavate, and his colleague, a startup, who won the Raghunath Mashelkar Inclusive Innovation Award 2020. This is an award that I have created in my mother's memory. This is the 11th year of the award. And during COVID, we said, let's look at startups which had done some phenomenal work. And Mudit Dandavate won that award for developing a system called DOSI. And the impact of that, if you had no ICUs, don't worry, you can take your bed and convert it into a step-down ICUs. And he used what is called as a ballistocardiography based technology. So what he did was that you have this patient lying, let us say, this is your bed, and you place this IoT-based system, sensor-based system under the bed. And actually, it can measure 7 of your parameters with 98.4% accuracy, 20 times cheaper than products used in ICU. And of course, it requires no maintenance, consumables, and prior technical expertise. And as you can see, you can take care at home, high-risk patients, elders, home isolation of COVID patients can be done, as well as ward monitoring. And just see the impact it had. It spread all over India. As a matter of fact, so many beds were upgraded. And you can see a poor nurse which was handling a few patients they could handle 16 additional patients. The time taken to monitor patients' vitals, not 50 minutes per patient per day, but just 10 minutes, and huge impact. I'm very proud to say this is going all over the world now. And CDC of US has ordered just now 5,000 such doses for use in Bangladesh, Africa, and other countries. And many private hospitals are now using this for online monitoring, even though the COVID challenge is no more there. What is the main point I want to make? DOSI came up in terms of the challenge that we had, and this young Mudit was able to deal with this challenge. We always look at technology sourcing from big national labs, from universities, from industry, but startups in India are playing a very major role. And I'm very proud to say that during COVID-19, they played a major role. You know, we have this venture center in Pune, and this venture center played a major role in getting together many of the startups to use these technologies. And you can see these startups. Diagnostics, I mentioned about MyLab, bioreactors, vaccines, vaccine carriers, defibrillators, oxygen enrichment systems that you see here, and so on and so forth. And this venture center team and volunteers participated in so many national endeavors on COVID. We heard about Pune Knowledge Cluster. I'm very proud of it. In fact, I wrote recently that it should be a role model. Just as there is a Pune Knowledge Cluster, there are knowledge clusters in several cities. But what Pune Knowledge Cluster has been able to do is absolutely phenomenal. And I feel very proud to be its chairman of the advisory board right from the time it has started. And it played a phenomenal role. If you see the PKC activities for PMC, Pune Municipal Corporation, they looked at the epidemiological modeling, CFR estimation, doubling time of cases, residence time in a hospital, and etc. And as a matter of fact, they were able to actually work out the testing strategies, what will be the number of ventilation, critical care forecasts, and so on and so forth, mortality forecasts. This was some wonderful work. They did the zero survey, and you can see it was supported by Persistent Foundation of a private sector. You know, when there is a challenge, everyone comes together. It is not just the government. And very happy to see they were able to assemble so many sort of partners, including ISER Pune and Pune University, CMC Vellore, THSTF Faridabad. And they have come out with scientific findings which are extremely precious. In fact, if you look at the disease and environmental surveillance that they did, data curation and analysis with so many partners, disease surveillance, environmental surveillance, data curation and analysis, and got so many partners involved, like sequencing was done by ISER and NCR, National Chemical Laboratory. And you can see they used cutting edge science, cutting edge technology, next generation sequencing to detect SARS-CoV-2. And actually, you can see that the scientific findings that they came out, diversity of lineages and genetic variants, were extremely impressive, very, very important. You know, what happened in the first wave, for example, diversity of lineages increased during the second wave, starting with Delta and 118 sublineages, and diversity of lineages decreased in the second wave, etc. These were very important observations. But most importantly, they took long-term immunogenic studies, once again in partnerships, and you can see the benefits, the effectiveness of COVID-19 vaccine or humoral or cellular immune responses over 9-month period in seropositive and seronegative individuals, as well as understanding the role of innate immunity, microbiome and micronutrient biomarkers. So fantastic work. So it was not the NCS of this world and the PKCs of this world and the venture centers of this world. Everybody came around. And I'm most impressed about the team Pune that work, Pune platform for COVID-19 responses. This was a volunteer group of businesses, civil citizens, NGOs, social organizations, medical community. They came together in an incredible way. 250 plus corporates, 1,000 plus donors across India, 50 plus NGOs, 250 plus government and private hospitals, and 10 plus government offices. This was extraordinarily impressive. And of course, they worked on increasing the healthcare capacity expansion. They had this mission Vayu for importing ventilators and oxygenators, increasing statewide capacities. They were supported by international companies, donors, and had huge impact. Then the second mission, of course, there was more emphasis on facilitation of critical care items, increasing the capacity, coordinated support, and so on. And in the third, they had several activities that I've listed here. Importing 500 units of ventilators. That's something that bothers us, isn't it? Personal protection equipment, for example, we're importing. And after this crisis came, within a year or so, we started exporting them. Ventilators, we're importing. Someone who can do Mars orbiter mission, can we not develop our own ventilators? That was the challenge we took up. And I chaired that challenge, this Marico Innovation Foundation of Marico companies. They created a prize of 2.5 crores. And this was called Innovate to Beat COVID Challenge. This was personal contribution from Harsh Mariwala and Amit Chandra. And the emphasis was on India needing not just innovation, but extremely affordable innovation, specific for Indian conditions. That can work under Indian conditions. No compressed medical air, frequent power cuts, limited trained technical staff. None of the imported equipment will work under these conditions. So we created our own, very proud to say. And you can see this ICU ventilator created by IIT Kanpur, the Shreyas company creating ventilator with automatic ventilation mode, as well as our own KPIT technologies in Pune, contributing to this lightweight, ergonomically designed device. Now, we must have talent, technology backed up by trust. And these are the ventilators now we need to basically back up. And once again, after the COVID is over, we should not be running abroad to get the ventilators. The other part which is not very visible is you use large number of personal protection equipment. And what happens to that? The kind of pollution it can create, the kind of challenge it can create. So I'm very happy that this polymer science engineering group of CSI NCL, and I'm a bit emotionally involved in it because 1976, when I came back, this was the group I established and they have done phenomenally well. Dr. Ashish Lele, who is the director of NCL, is one of the most visionary scientists of the country. And they actually jumped into this challenge. And what they did was about, just one second. Yeah. What they did was that they looked at the recycling of these PPEs by injection molding of recycled PPEs into automotive components. And as a matter of fact, they put up sort of trials. They collected the biomedical waste. They had to take, of course, permission from MPCG to get that waste. They signed agreement with Reliance, which is our biggest polymer producer. And then they created this particular process. And within that, you can see the correction of PPE suits, then removal of metal chips, then compounding and creating new products. And there were so many small and medium enterprises that got involved. All right. And these were the new products that were actually created from the waste PPEs. And this is very important because PPE suits manufacture incineration contributes significantly to global warming. And centralized incineration has high global warming potential. So we have to make it decentralized. That was very important. And we have to recognize that the carbon footprint of PPE suit manufacture is a matter of concern, and we require policies for segregation of source and decentralized recycling process. And India has shown the lead on how actually to do it. I think the most important part, this PKC concluded together with all the other partners, was the data-driven approach, which you have been talking about so far, is the way is the key to deal with epidemics and pandemics. And therefore, sequencing of data, geographical mapping of cases, epidemiological data, environmental parameters, they are all very important. And correlation of all these data with the clinical data will help in building robust warning system. And this implies that the public health action open source database, which enables researchers and analysts to make city level models for disease, will impact the outcomes and our strategies. Last point, in fact, it would have been nice if we had asked this lady to come here. This particular photograph, for those who are abroad and may not be aware, was about a month ago when HK Firodia Awards celebrated their 25th year of existence. This is Arun Firodia. This is Jayashree Firodia, his wife, Dr. Vijay Bhatkar, whom you know. I've been the chairman of the committee right from the time it started. And this year, all the award winners were ladies, by the way. You can see in the middle, Kiran Mazumdar, who created Biocon, started with 10,000 rupees in a garage, and her market cap today is $7 billion. And she's creating affordable therapeutics and vaccines for the whole world. This is Tessie Thomas, a missile woman of India. She's responsible for Agni missiles. So many people call her Agni Putri. And this is the lady who should have been giving this talk, because she understands this better than anybody else. She is Gagandeep Khan, the first fellow of Royal Society in 360 years, by the way, women's. And FRS, as you know, is considered as the greatest honor, one of the greatest honors after Nobel Prize. She was the first woman, but she developed the rotavirus vaccine, and she has been an authority on this subject. And she gave a talk, by the way, how we win handling viruses past, present, and future. So if you want to really get something from an expert, please go to the YouTube, look at this particular talk. I just picked up 2 slides out of hers. They were important. We will all create solutions like we have been talking about. All my lecture is about solutions, right? But what is needed for solutions to work? For the people. You can develop a vaccine, but they must take it, no? This is a vaccine hesitancy. You require resources, money. And finally, you require policy that is progressive. So that is very critical. And therefore, what needs to be done to stop the pandemic from happening again, and how do we do this? And it requires preparedness in terms of clinical, epidemiological, coordination, technology, and so on and so forth. And we must prepare our society against future pandemic. How do we do that? That's what she's saying. Aim to develop effective and safe pandemic products within 100 days. As soon as it hits it, agility and speed of action is very important. And therefore, we have to have preemptive research and development. That's very critical. We have developed that capacity today. We very proudly talk about Covaxin, which is our own vaccine. When we talk about 200 crore doses being given, we must realize that Covaxin played a major role, and Covaxin would not be there if all the science, technology, innovation platforms that we had, which after independence, several governments have put together, this particular platform was not there. We have to realize that. We have, and therefore keep on investing in R&D. Regulatory convergence and reliance, very critical. immediate sharing of pathogens with epidemic and pandemic potential and associated information as it happened this time. And global clinical trial infrastructure is what we require. And also most important is equitable access, finally, all right, for the people worldwide, not for selective few. And that means effective pandemic procurement. There must be some global norms on that, sustaining manufacturing capacity, strengthening health systems planning and delivery, and finally, improving global surveillance capabilities. This was my last slide. So you can see when we talk about the pandemic and the Punekars and the way they dealt with it, one should be very, very proud in the way they contributed and became kind of a role model. And so many organizations, including PKC, which is a co-sponsor of this particular event, they're playing a major role. So one feels extremely proud to be associated with all these institutions and seeing their performance, not just a promise, but performance, not only now, but in the future. So as Gagandeep Kang had succinctly said, everyone needs to be a stakeholder, we can do it. But while governments cannot and need not and should not take upon themselves all biodefense and health security functions, they must work with international organizations and other countries in the region to lay down and enable the policies, regulatory systems, and coordination to handle infectious disease threats. When we say Vasudhaiva Kutumbakam, it is one family. I think this total global integration and global thought leadership and global action leadership is what we require. Thank you. Thank you very much.
Wow, thank you, Dr. Mashelkar. That was a very enthralling overview of India's scientific progress in regards to the pandemic. I especially loved hearing about the startup to convert your home bed into an ICU. To our audience today, I should also say that we at JPF Analytics feel extremely grateful that Dr. Mashelkar has also agreed to be our mentor and provide us guidance.
Thank you, Arya, and thank you, Dr. Mashelkar. They say that facts can be stubborn, but statistics are always reliable. Speaking of that, now it's time for our second chief guest, Dr. Priya Nagaraj. She is the Chief Operating Officer for Pune Knowledge Cluster. She has a comprehensive understanding of Pune's innovation ecosystem and has also mentored many startups, teams, and projects to achieve their respective goals. I invite her to present the concluding remarks.
Thank you, Pranav. A very good evening to all of you, and thank you, Abhishek, and thank you to the JPF Analytics team for inviting me to be part of this celebration today, which is the completion of your 1 year in the being. And it is wonderful to see all the things that you have done in this past 1 year. And in many ways, we are alike, PKC and JPF, is that we believe in collaboration. We believe in collective responsibility of people coming together to work for the betterment of the city. It is also interesting to see that while we are in Pune, a lot of you are not. A lot of you are based in various parts of the world. But I think because of your strong association with Pune, you have decided to do so much for the city, although you're not here. So thank you for that. I must say that first of all, it was very, I think it was very humbling. It was also very, I think it was a moment of pride for me and also my colleagues who are watching this on YouTube today, who have worked very hard over the last 3 years to collect and curate the data based on which the analytics were done and presented today. I remember that I was not part of PKC at the time that the data, when the pandemic hit. I joined a little later. But I remember Professor Shashidhara and my colleagues telling me that, when we started collecting data, there was a lot of apprehension in terms of what are we going to do with this data? Because I think such an exercise of collecting such large amounts of data without really thinking of an end outcome, because we kept getting this question as, what are you going to do with all of this data? And what is the end outcome of this data? And at that point of time, the only thing we knew was that the PMC was putting out this data in an organized way every day, and they were willing to share this data with us. And when we started looking at this data coming out every day, we knew that at some point of time, this data collectively is going to be very, very important for decision making in the city. Although it was not very apparent maybe in the first few months of the pandemic. So we kept collecting the data. We got lucky here that the PMC actually put out this data every day systematically in the form that they did. Now, of course, looking back, we really wish that the city did this for other diseases that we've been grappling with for so many years, like dengue, malaria, chikungunya, TB, etc. If we were to just get population level data like this, even if it is not on a daily basis, but if it's on a fortnightly basis, monthly basis, or some even quarterly basis, you can see how much value that data would actually add to understand a disease in the city. While collection of data was one thing, I think we had to work to curate this data because data was not only coming in from the PMC, data was also coming in from other sources. So our team worked very hard to ensure that data was collected from reliable sources, data was curated appropriately, and data was also shared in a responsible way with our stakeholders. So like JPF, we have shared data with various stakeholders who have analyzed this data, and this data has, the analyzed version of this data has resulted in several publications ever since. We believe that the next step is policy recommendations. I think now that we have the data, we have various stakeholders analyzing this data and seeing insights coming out of it. Hopefully, all of this gets used to make policies for maybe not another pandemic, but even for other diseases and even for an epidemic going further from a public health perspective. I really liked the fact that, I think at the beginning, Abhishek mentioned that JPF is an organization which consists of 50 volunteers. And I think it's remarkable to see how just volunteering effort, with all of you having your day jobs and all of you doing, some of you studying, some of you doing your PhDs, can pull out time from your busy schedules, come together and do something for a bigger cause and for a better cause. And this is a model that PKC tries to emulate. This is a model that we work with. We work with a large number of interns. We work with research associates. We work with students. And we really believe that this participatory approach involving youth is the way forward. Thank you to Dr. Mashelkar for highlighting PKC's work. Where PKC is today, I think we owe a lot to you. We owe a lot to your presence as the chair of our advisory committee, your vision and your leadership and your direction. Just to add a little bit to what Dr. Mashelkar said, as an outcome, we did a lot of sequencing of COVID samples in the city to understand variants, to understand change of variants with time. And 2% of all positive samples were sequenced in Pune because of our efforts. And 6.3% of all the data that was submitted to a national platform called INSACOG came out of all these efforts. So clearly, just by organizing, bringing various organizations together, managing them properly, and ensuring that data is collected in a responsible way and data is uploaded on forums of importance, made such a big difference for one small city like Pune, where we could contribute so significantly in terms of data at the national level. We're very grateful to the Pune Municipal Corporation, to the Pune Municipal Commissioner, to all the authorities who till today continue to share data with us. Although we don't have a lot of COVID cases in the city today, they still continue to share data on a daily basis with us. We are also very thankful to the Pune platform for COVID response, because they used a lot of this data to make informed decisions on how many ventilators to purchase, which hospitals need it, which prabhags, which wards are actually facing crisis. So a lot of this population level data was used to make very high level decisions, even at the level of lockdowns and even predicting what is going to happen to the disease. I'm told by my colleagues that the environmental sequencing that we have done, where we've looked at sewage samples, where we were able to detect the Omicron variant 2 months before it was observed in the population. We were able to detect it in environmental samples. So these are some very, very powerful results that have come out of an analysis of this data. And now I can proudly say that this data is actually being analyzed globally and not just in Pune or not just in India. My last bit would be that the collective power of various organizations working together is something that we cannot achieve by individuals or individual organizations. And I think whether it is PKC or whether it is JPF Analytics or many such initiatives in Pune have proven that everyone clearly is a stakeholder, and everyone coming together to work for a common cause and bringing their own expertise and bringing complementary strengths, which can actually transform what a city can do in a crisis situation. Going forward, PKC is leveraging the consortiums that we have built for COVID. We intend to work on vector-borne diseases like dengue and chikungunya, and we are also interested in working on antimicrobial resistance, and this is going to be the phase 2 of our data-driven projects in the city, and we will be very happy to continue collaborations with JPF Analytics. From a personal perspective, I think when Dr. Mashelkar showed the slide about Venture Center, I was taken back to my days where I was in Venture Center when COVID hit. And I'm very, I think I was just very fortunate that I got to mentor many of those startups that he had listed to raise funding to get their products out. I was also part of T4, which is the Task Force for COVID Response, which was set up by the PSA office to look at repurposing of drugs, where we collected a large amount of data for existing drugs to see how and they can be repurposed for COVID, and some of them were repurposed for COVID post clinical trials. So with that, I think once again, congratulations to JPF Analytics. We look forward to a continued working relationship with all of you, and hope to see your entire team in Pune soon, and and stay in touch. So best of luck, and thank you to all of you.
Thank you so much, Dr. Nagraj, for your comments. And wow, like after Dr. Nagraj and Dr. Mashelkar, your speeches, I really don't think there should be anything more that needs to be said. Let me just take this opportunity, though, to formally thank you once again, Dr. Nagraj and Dr. Mashelkar, for delivering such important words of wisdom. I really appreciated one theme which, really stood out from both of your talks, was that the importance of collaborating, that there's only so much that one individual or one individual organization can do, but when people come together, great things can happen. I would also say that the importance of preventive work, that we are not just firefighting to prevent, or like to tackle an existing pandemic, but how can we work, there's a saying in Marathi ki tahan laglavar vihir khandne. Can we make sure that that does not happen, that we have enough wells so that when we are thirsty, there will be water all around. With that note, let me thank all of our volunteers from JPF Analytics. Let me also thank the larger team at Jnana Prabodhini Foundation and our host, our parent organization, Jnana Prabodhini in Pune, for all of their support. Thank you everyone for attending our webinar, Pandemic, Punekars and Policy. Please check out our website for a copy of our excess mortality report, as well as our interactive digital atlas. We would love your feedback, so please write to us at survey@jnanaprabodhinifoundation.org. Thank you, everyone.